This is Dr. Bev Knox, and you are listening to my Psychology Tutorials. Learn psychology while you sleep.
In this lesson, we will review the law, society, and the mental health profession. Let us first talk about the law and mental health. The mental health profession interacts with the legislative and judicial systems in two key ways. First, clinicians help assess the mental stability of people accused of crimes. And second, the legislative and judicial systems help regulate mental health care. Criminal commitment, what is that? The punishment of people convicted of crimes rests on the assumption that individuals are responsible for their acts and are capable of defending themselves in court. Evaluations by clinicians may help judges and jurors decide the fate of defendants and sometimes result in criminal commitment. If defendants are judged to have been mentally unstable at the time they committed the crime, they may be found not guilty by reason of insanity and placed in a treatment facility rather than a prison. Insanity is a legal term, one defined by legislators and not clinicians. In federal courts and about half of the state courts, insanity is judged in accordance with psychological testing, which holds that defendants were insane at the time of a criminal act if they did not know the nature or quality of the act or did not know right from wrong at the time they committed it. Other states use a broader American Law Institute test. The insanity defense has been criticized on several grounds, and some states have added an additional option: guilty but mentally ill. Defendants who receive this verdict are sentenced to prison with the provision that they will also receive psychological treatment. Still, another verdict option is guilty with diminished capacity. Depending on state laws, it is also the case that sex offenders may receive treatment as mentally disordered sex offenders, or more commonly under the state's sexual violent predator law. Regardless of their state of mind, at the time of the crime, defendants may be found mentally incompetent to stand trial. That is, incapable of fully understanding the charges or legal proceedings that confront them. These defendants are commonly sent to a mental hospital until they are competent to stand trial. What is civil commitment? The legal system also influences the clinical profession. Courts may be called upon to commit non-criminals to mental hospitals for treatment, a process called civil commitment. Society allows involuntary commitment of people considered to be in need of treatment and dangerous to themselves or others. Law governing civil commitment procedures vary from state to state, but the Supreme Court has ruled that in order for individuals to be committed, there must be clear and convincing proof that they are mentally ill and meet their state's criteria for involuntary commitment. In addition to mental hospital commitment, many states have established outpatient civil commitment. Let us review protecting patients' rights. The courts and legislators significantly affect the mental health profession by specifying legal rights to which patients are entitled. The rights that have received the most attention are the right to treatment and the right to refuse treatment. Mental health and legal professionals also cross paths in 4 other areas. First, malpractice suits against therapists have increased in recent years. Second, the legislative and judicial systems help define professional boundaries. Third, lawyers may solicit the advice of mental health professionals regarding the selection of jurors and case strategies. And fourth, psychologists may investigate legal phenomena such as eyewitness testimony and patterns of criminality. Let us review ethical principles. Each clinical profession has a code of ethics. The psychologist's code includes prohibitions against engaging in fraudulent research, taking advantage of clients and students, sexually or otherwise, and participating or assisting in enhanced interrogation programs. It also establishes guidelines for respecting patient confidentiality. Clinical practice and study also intersect with the business of economic worlds. Clinicians often help to address psychological problems in the workplace, for example, through employee assistance programs and stress reduction and problem-solving programs. Reductions in government funding of clinical services has left much of the expense of these services to be paid by insurance companies. Private insurance companies are setting up managed care programs whose structure and reimbursement procedures influence and often reduce the duration and focus of therapy. Their procedures, which include peer review systems, may also compromise patient confidentiality and the quality of therapeutic services. The remarkable technological services of recent times have affected the mental health field, just as they have affected all other fields and professions. In particular, these advances have contributed to new triggers for psychopathology. Mental health activities are affected by the personal needs, values, and goals of the human being who provide the clinical services. These factors affect the choice, direction, and even quality of their work.